Hi there. Thank you so much for joining me on today's episode of Monday Moments. Today, we're going to talk about boarding orders in the ED and how to avoid medical errors that are commonly occurring. If we haven't had the opportunity to meet, my name is Ananya and I am the founder and CEO of Impact Clinical Strategy Consultants. We help EDs and urgent cares improve operations and efficiency. All right, so diving right into it. The 5 ways that we can avoid or at least reduce medical errors from boarding. So, as we're approaching the second wave, and we know that boarding is going to occur in the ED, especially of high acuity patients, this is especially important to remember avoiding medical errors. So, number one, we have to create a foolproof charting orders that differentiate between ED stat orders as well as boarding and recurring orders that occur in the inpatient. And that needs to be conveyed in a clear and concise manner with training prior to the initiation of these orders to the nursing staff as well as providers. This is absolutely non-negotiable and extremely important to differentiate moving forward. Number two, ED and inpatient teams. So ED and inpatient teams are going to have to work extremely closely and have excellent communication skills. And this is important so that the streamlined agreements on who is managing the patient at what times, that is agreed upon very early in the communication and handoff. Number three, closed loop communication among the providers as well as nurses. This cannot be reiterated enough. This is extremely important in order to avoid any medical errors that are happening in the ED as a result of just assuming from either provider or nurse standpoint that boarding orders are going to continue for a unfinite time. So that is extremely important to convey that. Number four, having a clean and streamlined handoff that the nurses can provide the inpatient nurses, as well as the providers that can provide the providers that are going to be now taking care of the patient in the inpatient setting. This is extremely important to go over what has been done, what is needed to be done, however, in a more streamlined manner so that nothing is missed. Oftentimes, patient can be boarding for about 24 hours, so this is extremely important to keep in mind. And lastly, number five, updates on bed placement. So having updates and logistics on how the flow of bed placement are going to work, that's going to have to be a team effort. And this is going to help manage the expectations of not only the patients, but also the providers who are working in the ED. So they have an understanding of how and when the bed placement of the patient in the inpatient setting will work. I hope that you found this to be helpful to understand a little bit more about what we can do to step up and avoid medical errors as a result of long boarding orders and boarding time in the ED setting. If you found this helpful, please let me know, and I look forward to connecting with you on the next episode of Monday Moments. Take care.